Good morning. I convene this hearing on the Subcommittee on Oversight and Investigation to review the implementation of the Patient Protection and Affordable Care Act. Our witness today is Mr. Gary Cohen, the Deputy Administrator and Director of the Center for Consumer Information and Insurance Oversight at the Centers for Medicare and Medicaid Services. Mr. Cohen, I'd like to read you two quotes from your testimony before the committee last year. On April 24, 2013, when asked by the ranking member for benchmarks to measure CIO's progress, you responded, and I quote, "I think the keys are that we are on schedule and on track with the IT build that we are doing, which is clearly an important part of this." And then you added, "I think it is just important to take a look at each of the steps along the path and make sure that we are on track. But I'm very optimistic and confident of where we are at this point." Again, this was April 24th, 2013. Here's a second quote. On September 19th, less than 2 weeks before the start of open enrollment, when Dr. Burgess asked you if open enrollment would be ready on October 1st, you said, "Consumers will be able to go online. They will be able to get a determination of what tax subsidies they are eligible for. They will be able to look at the plans that are available where they live. They will be able to see the premium net of subsidy that they would have to pay, and they will be able to choose a plan and get enrolled in coverage beginning October 1st, unquote. When pressed further, you then responded, "I have nothing further to add to my answer." Now, those unqualified statements that the exchanges would be ready by October 1st are now contrasted against what we have learned through our investigation since the healthcare.gov website failed on launch. Mr. Cohen, on April 4th and 5th, 2013, just 3 weeks before you told this committee that you did not have any question about the exchanges being ready on October 1st, the McKinsey Company briefed you and a number of other members of the administration teams on this, on a number of risks facing the website and the federal marketplace. Those included late policy, delayed designs and building time, and unlimited time to test the website. I'd like to know, why did you feel confident telling the subcommittee on April 24th that everything was on track? Similarly, CMS's own emails from the summer of 2013 show that CMS officials were worried that healthcare.gov would crash on takeoff. And yet you again told us in September that everyone would be able to go online, select a plan, learn their subsidy, and enroll starting October 1st. Mr. Cohen, I thank you for being here today, and I know the number of times you have made yourself available to testify to this committee, and I do appreciate that. But it seems like you're faced with two alternatives today. Either you didn't know about the problems with healthcare.gov when you testified last year, or you did and you decided not to inform Congress. Now, this is part of a pattern for this administration and affordable care that is so disheartening to the American people. Promises made and promises broken. We have spent over $600 million on the healthcare.gov website, and the administration gave absolutely no warning that a disaster was approaching, and now we know those warnings were obviously there. The broken promises don't end there. After years of saying, if you like your plan, you can keep it, the President finally apologized. And what about the $2,500 decrease in premium that the President promised? We don't hear that promise anymore. And now recent news reports have discussed narrow provider networks as a consequence of Obamacare. Will Americans still be able to keep their doctors? And now we ask, will they be able to afford their deductibles? This hearing is not just about looking backward and determining who knew about the website, but one important purpose of this hearing is accountability. So, I'd like us to try and start fresh in 2014. But our ability to do so depends on you explaining fully and honestly what you knew, what you understood about the development of the exchanges and website as it was happening, and how that informed your testimony last year to this committee. Because, as we have often said, this is about more than a website, that people are to trust and rely on this system, and trust something so critically important to a family as their own health care. This administration needs to have an honest and open dialogue with the public about the status of the implementation. Promises of all is well just don't cut it anymore. With the start of coverage just a few weeks ago, there are many important issues to examine about how these exchanges are operating. If problems are looming, we need to get the facts on the table and do something about it before it is too late. Mr. Cohen, I hope you will give complete answers today to the following questions. Why didn't you tell Congress last year about the problems with healthcare.gov? How many people have actually paid their insurance premiums in the exchanges? Of those people who have paid their premiums, how many were uninsured and how many had their plans actually canceled? How much will the taxpayers end up spending on healthcare.gov website, and where are you getting the money for it? News reports have stated that not enough young people are enrolling. When will we know about the risk corridors and whether the federal and state exchanges are sustainable? So I thank you for being here today, and I yield now to the ranking member, Ms. DeGette, for 5 minutes.
Well, thank you, Mr. Chairman, and welcome Mr. Cohen back to this committee. I think, Mr. Chairman, we could probably stipulate to the fact that healthcare.gov had a rocky start. There's no doubt about that. But, you know, what I'm sitting here thinking, the longer the Republicans keep beating the dead horse about who knew what when and all of that, the longer they keep raising these faux issues, like the fact that they say the website's not secure, then I think the worse it's going to be for their constituents. Because after all, isn't our desire to encourage people to sign up for health insurance if they're eligible for Medicaid, to sign up for Medicaid if they're eligible for subsidies, to get those subsidies to help pay for their insurance? As I hear my colleagues on the other side of the aisle talk about this, I can't help but wonder if they really do want their constituents to have insurance. Last week's vote on the floor was a good example where we voted on this bill that said that we were going to have security in healthcare.gov. Now, everybody thinks we need to have security in healthcare.gov, but the clear impression given during the floor debate and also the debate in this committee before that was that somehow healthcare.gov is not secure, when in fact there hasn't been one breach of healthcare.gov. And in the briefing we had, the federal IT people told us they haven't had any more attempts to breach healthcare.gov than any other federal government website. And of course, private websites like, for example, Target are not exempt from that either. And so I just can't help but think that my colleagues on the other side of the aisle really don't want to have us implement this healthcare.gov or the entire Affordable Care Act in a reasonable way. They want to chill their constituents from signing up. And I think that's a darn shame. The good news is, and believe you me, I was one of the biggest critics on the implementation of healthcare.gov on this side of the aisle. It was rocky. It was rocky. But the good news is it does appear now that people are beginning to enroll in this in a robust way. Last week, Connect for Colorado, which is our state site, announced the figures for my state. We're about halfway through the open enrollment period, and already 50,000 Coloradoans have signed up for private insurance on the exchange, and about 90,000 have enrolled in Medicare. So this is 140,000 people who didn't have health insurance before. Now, this represents real progress. This represents a family that doesn't have to worry about how it will pay for treatment if a child gets sick or has an accident. It represents moms who can get preventative care, from breast cancer screenings to vaccines. It represents small businessmen and women who don't have to worry about losing their livelihood if they have an accident. Now, I'm proud of my governor. I'm proud of my legislature, Democrats and Republicans, and I'm proud of the leaders of Connect for Colorado for getting it up and going. I know we're not out of the woods yet. We're going to continue to have glitches, and we need to address those. But sitting around and trying to figure out what happened last fall, when everybody admits it was a disaster, does not help us towards fixing this problem in the future. I want to say one last thing. The White House released enrollment figures for all 50 states earlier this week. The national numbers mirror what happened in my state. Over 2 million people have signed up on the exchanges, and 4 million people have enrolled in Medicaid. That's 6 million people who didn't have insurance before. Now, minority staff released a memo this morning that showed Affordable Care Act enrollment is ahead of where the Medicare Part D enrollment was at the time that program went into effect in 2006. Right now, the Affordable Care Act enrollment is at 31% of projected enrollment, with half the open enrollment period to go. And at this point during Part D, enrollment had hit only 23% of projections. And Mr. Chairman, I'd ask unanimous consent to put that memo into the record.
Without objection.
Thank you. So, you know, I didn't vote for Medicare Part D. Most Democrats didn't. But we worked together to try to make it a success. And I think that's what we should do here. one of the things I continue to be concerned about with implementation of the Affordable Care Act and the exchanges is enrollment of young people. Now, I know everybody says they'll all enroll at the end, but I'd be interested to know from the administration what we're doing to make sure we hit those targets, because the exchanges are not going to work without them enrolling. And so in sum, let's work together to implement this, to get our constituents enrolled. Let's not sit around griping about what happened, admittedly, last year. Thank you, Mr. Chairman.
Gentleman yields back, and now we'll recognize the Chairman of the Full Committee, Mr. Upton, for 5 minutes.
Thank you, Mr. Chairman. Today we are going to continue our thoughtful oversight of the President's implementation of the health care law and its effect on Americans in Michigan as well as across the country. So, Mr. Cohen, we do welcome you back. You've testified before the committee a number of times, and I appreciate you returning again today. Preparing for today's hearing, we went back to review the transcripts, as you would imagine, of your testimony from last year. And when we asked what to expect at the start of the open enrollment of October 1st, you assured us on 2 different times that once in April and again in September, less than 2 weeks before the launch, that yes, everything was on track. And during your more than 4 hours of testimony before the committee last year, there was no mention of the fact that you had been briefed twice by McKinsey in early April of last year and warned about the number of risks facing the marketplaces and the website, nor was there any elaboration on the fact that CMS employees were well aware that the website build was riddled with problems, far behind schedule with the October 1 launch in jeopardy. So the purpose of today's hearing is not to rehash every detail of the failed launch, but to move forward, we've got to understand what you knew about the status of the website and implementation of the President's law at the time that you appeared before the committee. Looked us in the eye and said, of course, everything was on track. It's time to be candid and transparent with Congress and the American public. Lots of promises have been made. Many have already been broken. What's next? The only way the public can trust the healthcare system and the administration that is implementing the law is if the administration officials are open and transparent about the facts and what the American people should expect from the law and for their health care moving forward. Providing facts and specifics is an important first step towards restoring the credibility that we all want. American people deserve the peace of mind that there will be no more surprises, that the information available is the entire and true story, and I know that you'll try to help us understand what happened and provide some answers. And I yield the balance of my time to the Vice Chair, Dr. Burgess.
I thank the Chairman for yielding, and Mr. Cohen, I too want to welcome you back to the committee, and I appreciate the time that you devote to our oversight efforts. But here's the central question. How in the world can we expect people across this country to trust this administration when they've been continually told that everything will be ready, and in fact it was not? It's pretty clear now that the administration knew far more about the concerns prior to the launch of healthcare.gov before October 1st, and yet you came before us on September 19th, and each time you came to this committee in the past year, you promised that healthcare.gov would be functional October 1st. If I recall your recitation correctly, there were no contingency plans because none were necessary. You insisted to subcommittee members less than 3 weeks before the launch of the federal exchange that everything was on track. I'll stipulate that some parts of healthcare.gov may be working now, but they're only working now because a glitch czar had to be appointed after the launch of healthcare.gov. I don't know how you feel about that, but it upsets me that you came before this committee and told us everything was okay. We spent hundreds of millions of dollars. You had well over 3.5 years to get it right. And then we've got to appoint a glitch czar to sort things out so that people can actually enroll on healthcare.gov. The enrollment numbers, I think, are meager. Perhaps you have a different story, and you'll share that with us. But errors, canceled plans, and broken promises, those are just the start. Now we know that your agency, Health and Human Services, and the White House failed to heed internal warnings about the lack of readiness of the exchanges. It is my hope today that you came to this subcommittee prepared to answer our questions. I hope you will set the talking points aside. You owe this to your superiors at HHS. You owe this to the Secretary. You owe this to the President. You owe it to the Congress. And most importantly, you owe it to the American people. This committee is about oversight. Yes, that requires that we look in the past. Yes, that requires that we look to the future. I think the problems of the past dictate to us that there are going to be significant problems during this first year of healthcare.gov, and you need to be prepared to work with this committee to mitigate the damage that is going to be visited on America's healthcare system and the American people. And Mr. Chairman, I'll yield back my time.
Chairman yields back. Now recognize Ms. Castor for 5 minutes.
Good morning, and thank you, Mr. Chairman, and good morning, everyone. Mr. Chairman, this is our first hearing of the year on the Affordable Care Act. Last year, in this subcommittee and the Health Subcommittee and the full committee, the majority held 12 hearings on the Affordable Care Act. The hearings last year often were frustrating because they were not held necessarily to examine exactly what the law is doing or to work in a bipartisan fashion to improve the law. They were part of an effort to criticize the Affordable Care Act, spread misinformation, and build support for repeal of the Affordable Care Act. The majority's unrelenting focus on repealing the Affordable Care Act is one of the reasons, I believe, why this Congress has been one of the most least productive in the history of our country. But fortunately, we're at a different place today. As of today, approximately 10 million Americans have coverage because of the Affordable Care Act. Over 2 million have coverage through private plans sold through the marketplaces. More than 4 million have enrolled in Medicaid and now have access to a doctor or health services that they did not have before. More than 3 million young adults aged 26 and under have coverage through their parents' plans, and millions more have coverage purchased directly from an insurer. Now, as the ranking member, DeGette, explained, the rollout of healthcare.gov was anything but smooth, and I directly expressed my displeasure to President Obama and Secretary Sebelius. People were relying on us. And moving forward, I know there will still be hurdles to overcome over the next few months. But the law is working. Members who want to repeal the Affordable Care Act will have to explain to these 10 million Americans why they should lose their coverage and their new rights and their protections. And coming from the state of Florida, they're going to have to explain to my older neighbors, our parents and grandparents, why they want to take away the improvements in Medicare, closing of the donut hole, the new preventative care and wellness visits that are available, and the fact that we made Medicare stronger. The members will have to explain to the 129 million Americans with pre-existing conditions why they do not deserve the same access to health coverage as everyone else. They will have to explain to American women why they want to go back to a world where they could be charged more for the same coverage as a man. And they will have to explain to people who work in blue-collar jobs why they should face higher premiums. And they'll have to explain to the millions of Americans getting coverage for the first time why they would be better off uninsured. I do not think my Republican colleagues will be able to make this case. Mr. Chairman, Republican critics of the law were also incorrect about many things, but they were right about one major fact, that once the Affordable Care Act went into effect, there would be no turning back. This law is in effect, and it will continue to become a part of the fabric of this nation. It will lift millions of American families, provide economic security. The Civil Rights Act, the Social Security Act, the original Medicare legislation, all landmark laws were enormously contentious in their time. Republican opponents predicted they would put this nation on the path to ruin. They said the nation was not ready for the changes that were coming. They said the new rights and protections the laws guaranteed for our fellow Americans were not important. And now we cannot imagine our country without a basic safety net for our seniors or equal rights for all of our citizens. In the years ahead, all the hyperventilating about broken websites and enrollment trajectories and demographic mix will quickly be forgotten. Instead, we will look back and wonder how we ever had a health system that spent double what every other nation spends per capita while leaving 50 million uninsured and allowing rampant discrimination against the people who needed the coverage most. I hope this hearing will be the start of a productive and cooperative session of Congress, and I hope we can start to work together. on the ACA, rather than spending another year in a never-ending campaign against a law that is doing enormous good for the American people. I yield back. Thank you.
Gentlelady yields back. So I would now like to introduce the witness for today's hearing. Gary Cohen is the Deputy Administrator and Director of the Center for Consumer Information and Insurance Oversight at the Centers for Medicare and Medicaid Services. He has served as General Counsel for the California Health Benefit Exchange and has served as the Director of the Division of Insurance Oversight in CCO for 2 years prior to becoming the Deputy Administrator and Director of CCO. And I will now swear in the witness. Mr. Cohen, you're aware that the committee is holding an investigative hearing, and when doing so, we have the practice of taking testimony under oath. Do you have any objection to testifying under oath? Thank you. Chairman, advise you're under the rules of the House. You're entitled to be advised by counsel. Do you desire to be advised by counsel? In that case, we'll swear you in. Do you swear the testimony you're about to give is the truth, the whole truth, and nothing but the truth? You are now under oath and subject to the penalties set forth in Title 18, Section 1001 of the United States Code. You may now give a 5-minute summary of your written statement. Mr. Cohen.
Thank you. Good morning, Chairman Murphy, Ranking Member DeGette, and members of the subcommittee. I appreciate the opportunity to update you on the Affordable Care Act and health insurance marketplaces and to talk about the millions of Americans who, many for the first time, are able to purchase high-quality, affordable health coverage. When I appeared before this subcommittee shortly before the beginning of enrollment, I said that while we may encounter some bumps when open enrollment began, we would solve them. Clearly, the problems we encountered in October were far worse than I or any of us anticipated. Simply put, the system did not work nearly as well as it should have or that we expected that it would. This wasn't a time to get discouraged. It wasn't a time to give up. It was a time to roll up our sleeves and get to work and solve the problems, and that's what we did. Since that time, we have fixed healthcare.gov piece by piece in a prioritized, metrics-driven manner. The tech team fixed the site's software and enhanced the site's hardware to improve its capacity, speed, and stability. By the end of November, healthcare.gov was able to support more than 800,000 consumer visits per day with a response time of less than 1 second and an error rate well below 1%. Consumers have responded overwhelmingly to the improved site. Enrollments in the federal marketplace in December alone represent a 7-fold increase over October and November combined. By the end of December, nearly 2.2 million people had selected plans from the state and federal marketplaces. Sometimes we lose sight when we talk about numbers that are this big, that these enrollments are more than just numbers. They are individual people, many of whom have not been able to obtain needed care or had the peace of mind that comes from having health coverage for years. For example, Nathan Aldridge, a cancer survivor from Virginia, now has a plan without having to worry about paying more because of his pre-existing condition. He had been paying for a plan with a $483 monthly premium and a $5,000 deductible. Now he has a plan with a $111 monthly premium and a $1,750 deductible. Emily Wright, a university student in Tennessee, enrolled through the federal exchange, qualified a federal subsidy, and picked a top-tier plan that will cost her only $125 a month. She's been able to get an appointment with an obstetrics gynecology practice, the first step before needed surgery. We hear stories like theirs every day. Because of the Affordable Care Act, Americans like Nathan and Emily can be confident that the plans offered in the marketplace are high quality and affordable. The Affordable Care Act standardizes certain essential benefits which insurers must offer. These include basics like doctor's visits, hospitalizations, prescription drugs, and maternity and newborn care. Marketplace plans are designed so that consumers can compare plans with similar levels of coverage and make more informed decisions. Insurers are now prohibited from charging higher premiums to enrollees because of their health problems and from charging women more than men, making pricing more fair. At the same time, premium tax credits and cost-sharing reductions are helping consumers pay for their health care coverage. Of the nearly 2.2 million marketplace sign-ups so far, nearly 80% of those consumers are receiving financial assistance. Insurers can no longer refuse to accept consumers because of a pre-existing health condition. With limited exceptions, plans are required to enroll individuals regardless of health status, age, gender, or other factors. Finally, insurance coverage is there when people most need it, because plans can no longer impose annual or lifetime dollar limits on essential health benefits. Americans no longer have to worry about hitting a prohibitive dollar amount which could force a consumer into bankruptcy or cause them to have to forego necessary care. The health insurance market in 2014 looks dramatically different than it did in the years before the Affordable Care Act. Now, as with any change this major, there's bound to be some disruption. So to ease the transition to the new market, CMS is working closely with insurers, consumers, and other key stakeholders who are working together to ensure that consumers have coverage and receive needed medical care. In December, CMS announced a number of steps to help consumers, including requiring insurers to accept payment through December 31st of 2013 for coverage beginning January 1, and giving consumers additional days to sign up for marketplace coverage. Insurers have also stepped up, with many agreeing to voluntarily extend the deadline for consumers to pay their first month's premium. And many pharmacies announced plans to ensure a smooth transition by providing consumers with transitional supplies of prescriptions. I continue to believe what I said in September. The ultimate story of the Affordable Care Act will not be what happened in the early days that the website went live, or even in the first days of January as people used their new coverage. The lasting legacy will be people like Nathan and Emily who will be able to get the health care they need and have the security of knowing they will be able to pay for it because of the changes made by the law. Thank you, and I welcome your questions.
Thank you, gentlemen. The chairman now recognizes himself for 5 minutes. Mr. Cohen, you testified several times for this committee that HHS would be ready by October 1. Can you tell us why you were wrong on that?
When I testified, Mr. Chair, both you referred to April and in September, and each time I gave you the best information that I had and gave you truthful testimony based on the information that I had available to me. It turned out that the problems that we faced when the website went live were, as I've said and as everyone knows, just dramatically different and bigger than I think what any of us expected. As to why we didn't anticipate what was going to happen when we went live, I'm not sure I know all the answers. I think some of the people who are responsible for designing and building the website might be able to give you better answers. I know initially we were overwhelmed by the volume of people who came in, but as time went by, that was clearly not the sole source of the problem. There were other problems as well.
Well, let me go this. But you were there for the briefings and the McKenzie report, which we discussed in this subcommittee of the disaster that they talked about to a number of people within the administration. So you had that information, but you also said you were told something otherwise. So who told you otherwise that things would be fine?
So may I speak for a moment to McKinsey? I mean, I absolutely attended briefings of the work that the McKinsey folks did, and there's no question that they identified a number of risks that they saw back in April for whether we would be successful come October. At no time did the McKinsey people say to us, you're not going to make it or you're not going to be successful. They identified a series of risks, and they identified some steps that they recommended we take in order to mitigate those risks and increase the likelihood that we would be successful. And I think we did those things. And I think that a number of the concerns that McKinsey expressed, for example, whether the hub would be working or whether some of the larger states like New York and California would succeed, did not prove to be a problem. The hub has worked very well. New York and California have done very well. So I think we took very much to heart what the McKinsey people recommended that we do, and we proceeded forward and tried to do the best we could to maximize the likelihood that we would be successful.
But again, we've looked at the McKinsey report. It was not subtle. It was strongly worded in terms of there were serious problems, but in that same month you came before us and said things were fine. So who on your staff told you that things were going to be okay? Who informed you specifically?
I received regular briefings from the various parts of CMS that were responsible for overseeing the website build. The person that I heard from the most probably was Henry Chow.
And Henry Chow told you that despite the briefing from McKinsey that things would be okay?
Henry Chow gave, we had regular reports on the status of the build. And certainly when I came here in September, the testimony that I gave was based on briefings that I had from Mr. Chow and others as to what the capability of the site would be.
Did you share with Mr. Chow the McKinsey briefing?
I don't know whether he saw the briefing itself.
Did you discuss the contents of that with him?
I think we talked about the issues that were raised in the briefing, yes.
See, I'm puzzled because when Mr. Chow was here speaking under oath, he said he didn't know anything about it.
That's why I say I don't know that we told him or that he saw the report itself or that he was, but we talked about the issues.
So let me ask this. I mean, it was significant enough that the Secretary said that she hired McKinsey to give them a briefing and look at this analysis. Very important. Significant problems were identified. They were not small, but now we're not sure whether or not the key person who was advising you of this was even told about this report to identify and what to do about the major problems. So there's something pretty inconsistent here.
Well, I think that we adopted a number of the recommendations that McKinsey had for us and put into place a number of the things that McKinsey recommended that we do in order to increase the likelihood of our success. And that's what I mean. Those things happen. So Mr. Chow was aware of the things.
Well, I need to know what specifically. If you go to the doctor and the doctor says, can you tell me what your specific symptoms or problems are? If you don't tell the doctor what your problems are, they can't properly diagnose and treat. So what specifically did you tell Mr. Chow, and what specifically then did he do in response to that?
I'm not going to be able to recall or tell you exactly what we told Mr. Chow. What I can tell you is that there were recommendations, for example, in the report with respect to how we should be organized and some changes that they recommended that we make in terms of how the process was managed that we implemented as a result of the report.
Thank you. Recognize Mr. Gett for 5 minutes.
Thank you very much, Mr. Chairman. This hearing today, I just noticed this after my opening statement, is called 2014 Seeking PPACA Answers. So I'd really like to ask you, Mr. Cohen, some questions about where we go from here. As you acknowledged in your opening statement and your written statement, the problems with healthcare.gov were far greater than ones you anticipated before October 1st. And we're all now well aware of the administration's efforts to fix the problems. I'm wondering if you can tell me, as we sit here today, January 16th, what problems do you still see with the federal website, and what steps is the administration taking to remedy them?
Thank you. We continue to address specific issues with respect to the way that the site is functioning, and that effort has not flagged at all. I mean, it's ongoing. So as we continue to identify any aspects in the way that the system isn't performing as properly as it should, whether those be design and architecture or whether those be software, sort of coding types of problems that we're not, getting the right result, we continue to address a lot of those issues. The major one that we're dealing with right now, I would say in terms of big picture, has to do with the financial management, making sure that the plans are getting paid. We're using a mitigating process right now because we don't have full functionality for that particular process that we're working toward putting that in place.
As we heard in November and December, the administration was focusing first on getting people enrolled, and then they were worrying about the back end. So with that back end, what kind of problems are we still seeing, and what are you doing to try to remedy that?
Right now, payments will be going out next week for the first time of advanced premium tax credits to issuers, but we're using a process where they're providing us with the data from the issuers based on their records, as opposed to being able to use the records that are generated by the FFM, and that more automated process will be going into place in the next months.
And is the administration working with the insurers to make that happen?
Yes, absolutely. And we've actually had tremendous responsiveness from the insurers, and they've told us that they're very pleased with the way that process is going. It's not ideal, but it will work to get them paid.
Mr. Chairman, I think that would be a good follow-up hearing to bring the insurers in and see how that's working, just FYI. Let me ask you, Mr. Cohen, we've all heard about the number of people who have signed up both on the state exchanges in the states like mine that have state exchanges and also healthcare.gov. What's your opinion about the number of people who have signed up and also the age mix?
So in terms of the number of people signed up, obviously there's no question that we got off to a slower start than we would have liked and than we hoped. But we had tremendous response in December, and we're continuing to see very good numbers as we go into January. I think in terms of the total, if we're able to maintain the pace that we're at now, and if we see another, sort of uptick towards the end of March, as everyone expects, because that's the deadline for the end of open enrollment, we still have almost 3 months to go. So I think we're very encouraged by the enrollments that we're seeing now. There clearly is tremendous demand for this product. We saw that from the beginning.
But there's also, I will say though, that because of the glitches with the website in the early days, the enrollment has been lower than the administration had projected, correct?
That's true.
And what about enrollment of younger people?
So, we're actually quite encouraged by the response that we've gotten from younger people. The percentage of younger people that we reported this week is actually comparable to the percent of that age group in the general population. So I think that's looking good.
And if you could just briefly tell me what the administration is doing to bump those numbers back up between now and the end of March, both for the general population and also for the younger enrollees.
Absolutely. So, I think you're going to see even a stepped up media campaign. Obviously, we, as well as the health insurance companies, held back a little bit in the beginning because the site wasn't working well. But now that it is, I think we'll see a significant increase in that. It's going to be very much targeted at the younger audience. So we have a Magic Johnson ad that's coming out now. We're going to be advertising during the Olympics. We're trying to advertise in ways that will definitely, and through social media as well, ways that are definitely targeted toward that younger group.
Thank you very much. Thank you.
You may want to talk to Jimmy Kimmel because he's not saying good things about this.
We can also have ads during the Super Bowl because I know that'll appeal to the Colorado voters.
That'll be costly. There you go. Now recognize Dr. Burgess for 5 minutes. Thank you.
Thank you, Mr. Chairman. Mr. Cohen, I'm going to bring this up. I got to do it. Need to have you address it. September 19th, 2013, I asked you a yes or no question. Will the enrollment process be ready October 1 of this year? I'll remind you of your answer. You said consumers will be able to go online. They will be able to get a determination of what tax subsidies they are eligible for. They will be able to look at the plans that are available where they live. They will be able to see the premium net of subsidy that they would have to pay, and they will be able to choose a plan and get enrolled in coverage beginning October 1st. Do you recall that exchange, sir?
I recall it very well.
Knowing what you know now, would you like to revise that answer in any way?
Well, clearly it was wrong, but it was also what I believed and what I understood based on what I had been told. I'd like to answer your question, if you would permit me. I knew that I was going to be asked that question, obviously, when I came here on September 19th, and I knew that it was very close to October 1st. And I was very careful to get a thorough briefing from the people who were responsible for overseeing the build of the website. And the answer that I gave you was exactly what they told me our functionality would be on October 1st. Exactly.
Who told you that exactly?
Mr. Chow was in the briefing, among others.
Well, look, I just got to tell you this, and you've heard me say it before, and I'll continue to say it in the future. I simply do not understand why no one has been held accountable for an error that egregious. If I were you, I would fire someone under me, and it would have happened in October. If I were the secretary, I would have fired you, and that would have happened in October. And if I were the president, I would be so mortified and embarrassed by what has been the disaster of my signature piece of legislation signed into law, I would fire the whole lot of you. Now, that was a tack not taken, but I do not understand why why should we believe you now when nothing you said over the past year and a half has been accurate?
Because the site is working, Congressman. Because the site is working. That's why you should believe me now. And if we had all been fired, it would not be working.
Because it has not been built on the back end. Provider payments are not flowing. The subsidies that are supposed to go to the insurance companies, they tell me, are coming as a result of a paper process that's having to be entered by hand. This thing is a disaster. And the providers are going to be the ones who take it on the chin, because we are obligated to see those patients when they show up. No one can verify benefits at 3 o'clock in the morning. You take care of the problem after the fact who pays the bill. The secretary said she would not be responsible for paying those bills. So I ask you, doctors and hospitals around this country are asking you, who is responsible for paying those bills? You haven't built the back end of your website
The insurance company that has enrolled a person is responsible for paying those bills, and the payments of tax credits and cost sharing reductions to those insurance companies will be flowing next week. They will begin next week. That's
and I would submit to you that part of the website has not yet been built, and that is going by hand, and it is a painfully slow process. I've been told numbers as low as 5 to 10% of those payments are going through. I would appreciate if you have additional information that you will make it available to the committee. I hope we will have an opportunity to discuss that in the future.
Absolutely.
Because it does concern me a lot. I think our providers are the ones who are truly at risk from your mismanagement of this problem. Now, there is something that's receiving a lot of attention right now. It's the concept of risk corridors and risk adjustment. Are you aware of that?
Yes.
The risk corridor program does not contain specific appropriation in law. So are you going to be seeking an appropriation for the risk corridor language in the law?
I'm going to have to refer you to the Office of Management and Budget with respect to those issues.
Would you be willing to share with us the ongoing discussions that are happening between you and OMB on that? Are there emails? Are there memos? Is there information you can make available to the committee?
I will certainly take that request back.
It appears to a lot of us that you are going to be needing and sending taxpayer dollars in order to handle this problem of the risk corridors. Can you assure the committee today that that will not be happening, that this risk adjustment will be done from within the balances available in the Affordable Care Act and those amounts that you're collecting from insurance companies and not come from the taxpayer?
I think I don't have an answer for you today. I understand it's an issue. We're working with OMB, and I'll certainly, work with you and understand that it's an important issue that you are entitled to know about.
If you have a legal memorandum that has been prepared for you or your department, will you share that with the committee?
That's not a decision I get to make, but I will certainly take your request back. I haven't seen such a memorandum myself, no.
You have not?
Not at this point, no.
Do you anticipate seeing one?
I don't know the answer to that.
This committee needs that memo, and I want you to take that request back with you. Again, we'll have an opportunity to talk again, I believe.
Thank
I
you.
yield back, Mr. Chairman.
I want to give you an opportunity to answer one of Dr. Burgess' question. Has the part of the website dealing with payments been built, or is it yet to be built?
The automated process for payments is still being built, but we have a process in place that is working, and payments will be going out next week.
You have an anticipated date of when it's going to be built?
I don't have an answer to that as I sit here, no.
Thank you.
Mr. Chairman, could we have him supplement that when he finds out when it will be built?
Yes, we'd like to know that. Ms. Castro, you're recognized for 5 minutes.
Thank you, Mr. Chairman. Good morning, Mr. Cohen. You know, the headline back home in Florida this week was Florida enrollment surges under healthcare.gov. During October and November, due to the problems with the website, we only had 18,000 Floridians sign up for coverage. But in December, we had 140,000 Floridians sign up for coverage. Florida continues to lead the nation in enrollment among the 36 states that are using the federal marketplace. So this is good news. In fact, on Monday in Tampa, the mayor of Tampa, Bob Buckhorn, had a great announcement, and this is something that other members of Congress can use and work on with their elected officials. Mayor Buckhorn announced that all of the parks and recreation centers in the city of Tampa would be available to host navigators and assisters sign up, many of our neighbors, for coverage. I think this is a very creative move. Secretary Sebelius gave him a pat on the back as well. We've got to make it easy for folks to sign up, and one of the things that is, I guess, a good problem to have is we have such a competitive marketplace in the Tampa Bay area. We have over 100 private insurance plans that people can examine and see what works best for them. But, you know, that can be a little daunting for folks as well if they just go on to, I guess there are people that can go on to healthcare.gov and figure it out and analyze it and determine what works best for them. But there are many, many people all across the country that need to to sit down and work with a real person and sort through those options, understand what the tax credits do. In Florida, 2/3 of those who are eligible for coverage will be eligible for the tax credits. Already, over 80% of the people who have signed up have used those tax credits. What can we do to get more help out on the ground to help people understand the options?
So thank you, Congresswoman. I think it's very important, as you say, to get support from state and local officials, from congressional offices, to help get the word out, to direct people to assisters who can help them. There is a Find Local Help section of healthcare.gov where people can say, you know, what area they're in and get a list of the.
So many people, if they don't have a computer, if they don't even know about that.
Right. So
how are we going to reach them?
For the people who don't have a computer, obviously the effort really has to be to bring them in to a location where, you know, a navigator is working or you know, other assisters are available to help them through the process. And I think, you know, the more assistance that we can get from people in the community who know these folks, rather than, you know, just coming from the federal government, is a big help.
Yeah, our community health centers have been very active. Churches, it's really a community-wide effort. But I appreciated that you said, talking about the millions of folks who have signed up, that these are not just numbers; these are real people. And really, one of the biggest obstacles right now for many of our neighbors to realize health care coverage is what Republican governors and state legislators have done in blocking the Medicaid expansion. For example, in the state of Florida, we have almost 1 million Floridians who are being blocked. The access to the doctor's office is being blocked just because they won't accept the $50 billion available to the state of Florida over the next 10 years. That's our tax money. We want that tax money back to work for our neighbors, to help our families get to the doctor's office, create jobs, help our hospitals. Mr. Chairman, I think we need an oversight hearing on these states that have blocked Medicaid expansion and what that's going to do to the health care marketplace. Mr. Cohn, what's HHS's plan to continue to work with states on this issue?
We certainly, you know, encourage every state to take up the Medicaid expansion. It's a great deal for the state. It's a great deal for the people in the state. It's a great deal for providers in the state who will have, you know, see a decrease in uncompensated care, a tax that falls on all of us. And we have been working as creatively as we can with different states to come up with different ways of doing this. Some states have some different approaches that they wanted to take that we've been working with them on. So we continue to work with all the states and hope that more will take up the expansion.
Thank you very much.
The only yields back now the Vice Chair of the full committee, Ms. Blackburn, for 5 minutes.
Thank you, Mr. Chairman. Mr. Cohen, you just said that your testimony to Mr. Burgess on September 19th was incorrect and you had based it on staff reports. Am I correct in that?
I said it turned out to be wrong.
Turned out to be wrong.
Turned out to be wrong.
Let me ask you this then. If you're basing your testimony today on staff reports, how do we know that this is correct?
I think that there has been an intense focus since October on...
Have you changed your process of due diligence? Are you vetting? Are you questioning?
I think we're receiving more and more thorough briefings at the leadership level.
How do you know that? If what you told us in September 19th was wrong, how do you know that what you're telling us right now is correct?
You know, ultimately, I have to rely on the people who work for me. I don't...
You didn't fire anybody then? Are you watching them more closely now?
I think we are having regular and very detailed briefings on.
Okay.
And we also brought in what we sort of call the general contractor, the QSSI company that was an existing contractor on the project.
You want to quantify those briefings for us as you submit things about the website and when it's going to be due? Why don't you let us know what briefings you are having? Also, I want to ask you one thing real fast. You said the website is fixed. Can you define fixed?
I think the website is fixed in the sense that we no longer are having problems that we had creating accounts in the beginning. The
So it's
responsiveness
not
of the site.
100% operational. It is a qualified fix.
That's true.
Okay, so it is fixed as an amoeba, and that's going to change as you come back to it. So let me move on. You had 3 promises in Obamacare. It was built on 3 promises. It was going to save families $2,500 a year. And the second 2 promises, one, if you like your plan, you can keep it. And if you like your doctor, you can keep it. So let me ask you this. Since the president promised that the average family would reap a premium decrease of $2,400 a year under the law, has that happened?
Well, I'm not sure that's what the president said.
Yes or no? Yes, he did say it.
I'm not sure that's what the president said.
Yes, sir. He did
many,
say that.
Many Americans are able to obtain better coverage at lower costs than they were
Mr.
before
Cohen,
the Affordable Care
that
Act.
is not what the president said, and I ask for a yes or no answer. Let me move on. The president said if you like your plan, you can keep it. Has he kept that promise?
The law permitted insurance companies to maintain grandfathered plans in effect. That was their decision whether to continue with those plans or to change.
No, sir, that was not the promise. The
So,
president even apologized for this, and he offered some enforcement relief so that these peoples could keep the plans they liked. Is that correct?
I was about to say that
Okay.
not all Americans were able to keep their plans because of the decisions that the industry had made, and so we announced a transitional policy that enabled more of those plans to stay
How
in
long
effect.
will that transitional process last? A year? 2 years?
As of now,
Forever?
what we've announced so far is it's for a year.
You know, a lot of those people couldn't keep their plans, and you talked about an Emily from Tennessee. Let me tell you about another Emily from Tennessee. Emily lives in Pulaski. Emily had coverage because Emily has lupus. And guess what? Under Obamacare, her plan was canceled. Emily doesn't have health insurance right now. She's having a tough time getting it under Obamacare. I'm having her in as my guest for the State of the Union. Maybe you can help Emily work this out, Mr. Cohen, because your promises that were made by you and this administration have not been kept, and then you want to give us a qualified definition of fixed, and you are still depending on your staff, so you all are just running in circles. And you cannot give us definitive answers. So let me ask you this. Emily in Pulaski, she had a doctor she liked. Is she going to be able to keep that doctor even though she has no insurance? Then because of Obamacare, her insurance was canceled, and she is trying to be treated for lupus and work 40 hours a week.
You know, if you will get us information about if Emily's willing, interested in talking to somebody from CMS who can help her understand what her options are, what may be available.
I appreciate that very much.
We'd be happy to do that. We're doing
because
that for many.
she is a classic victim of what has happened when the federal government stepped in and said, all these plans that you have that work for you, that fit for you, we're not going to let you keep them because we, the federal government, think we know better how you, Emily, can handle your lupus. Now that is what you have done to the American people. And when you come in here, you give us misinformation, and then when we ask you a question, you cannot be specific. Mr. Cohen, I agree with Dr. Burgess. You ought to be fired.
The gentleman's time has expired. I recognize now the gentleman from Vermont, Mr. Welsh, for 5 minutes.
Thank you, Mr. Chairman. Mr. Cohen, there's a lot of things in the Affordable Care Act, but many of those provisions are about consumer protections to ensure that Americans do have a diverse choice of health care providers. But as with many new laws, there's some wrinkles in the implementation and some disagreement between debate about congressional intent. And I wanted to ask you about one of those with respect to the ACA. I've been hearing from some providers, and I know some of my colleagues have been hearing the same concerns, about the interpretation of the provider non-discrimination provision in Section 2706 of the Public Health Service Act. And specifically, what some of these providers are telling me is that your agency's sub-regulatory guidance, in their view, and in the view of many legislators is inconsistent with the statute and legislative intent. And the concern is this, that the guidance could lead, in fact, to discrimination against some providers by health insurers, which this provision was designed to prevent. Are you aware of these concerns? And my question is, what are your plans to address them and to ensure that the statute is implemented as intended?
So thank you, Congressman. And yes, I am aware of those concerns. I have had meetings with a number of provider groups who have expressed the concern that you've raised. Frankly, it's been a while since we looked at that issue. So what I would ask is that we could have folks, talk to you and your staff and move forward to understanding what the concerns are and seeing whether there's something we can do to clarify the guidance so that we make sure that there isn't discrimination, which clearly is what the law.
Well, that would be helpful, and there may be some colleagues on the other side of the aisle as well who are hearing some of these concerns. So I would welcome the opportunity to follow up with your agency and try to work this out to make certain that we stay on that intent that there not be discrimination.
We'd be happy
as
to do that.
Providers. Thank you. And just a couple of things. One of my concerns from the very beginning is we've got to get health care costs down. I don't care how we pay for it, whether it's employer-based, taxpayer-based, individual-based. If the cost is going up a lot faster than wages, profit, and growth, we're just not going to have a sustainable and affordable system. And what we're learning now is that Medicare spending is growing slower than the inflation rate. This is recently, and that's a welcome development. That the program spent only 0.7% more per beneficiary in 2012 than in 2011. 5 years ago, that annual increase was 5.4%. Also, just in overall global health care spending, the rate of increase has slowed. It was 3.7% in 2012, less than half of the growth rate a year ago. Two questions. One, do you attribute any of this to the law? And number two, what are the implications for the deficit over a 10, 20-year period?
So I think that the law does contain a number of provisions that are attacking the question of health care costs. I think that that's an issue that we need to continue to work on, and I think that the law does give us some tools to continue to do that. I look forward to using our process of certifying qualified health plans going forward. We were quite liberal, I guess is the word I would use. We sort of took them all, the first year to get the market up and running, but I think going forward we can at least look at what we can do to encourage health insurance companies to work to keep costs down. And certainly, we know that the health expense is a huge part of the American economy and of the federal government spend. So as we are able to attack that problem, it will have a very positive impact on spending and the deficit going forward.
Gentleman yields back now. Recognize Dr. Gingrey for 5 minutes.
Mr. Cohen, thank you for being with us once again. I asked you the last time you were here whether you had concerns that young people would not sign up for Obamacare and would cause an increase in cost to the rest of the risk pool in the following years. You responded that your research, this is a quote, research shows that most people want health care, and the barrier has been the cost, and that you are looking forward to people, including young people, enrolling in coverage. With the latest figures showing that young people are enrolling at a much lower rate than you had originally anticipated, are you now worried, are you still worried that premiums will increase next year, that it's not just the natural tendency for young people, indeed for all of us, to procrastinate, that there's some other concerns such as maybe these overwhelming number of mandates which we knew 10 years ago were driving up the cost of health care insurance in the individual states, probably all 50 states, including mine of Georgia. We knew these age banding rules that were put in Obamacare, rather than, say, 5-to-1 maximum premium increase for older people compared to younger, is now 3-to-1. community ratings, and these things are there, and I'm real concerned. Do you continue to be concerned about that?
Well, we certainly, want to do everything we can to encourage, all Americans and in particular young Americans to get health care. I think it's important to keep in mind that the risk pool is not just the risk pool in the marketplaces. The risk pool is in the entire market. And so when you have, say, 3 million young people who have been able to get health coverage on their parents' plans, those are not necessarily in the marketplace, but those are 3 million young Americans who didn't have insurance before who do have insurance and are part of the risk pool. I also would just point to a recent study by the Kaiser Family Foundation, which actually said that a reduction in the percentage of people, young people who come into the risk pool, will have an impact on healthcare premiums that's pretty modest.
Yeah,
so,
of course, some of that's anecdotal. I understand what you're saying, but let me move to my next question. I am concerned. I've heard that navigators are actually going door to door, and this came up last time too. And you said that navigators would not be going door to door. They are. And if you recall, during that same hearing, you told us, this subcommittee, that you would be, quote, issuing instructions to navigators that they should not be going door to door. Did you issue these instructions?
Yes, we have, and if you're aware of instances where navigators who are our grantees are going door to door, we certainly want to hear about those.
Well, I thank you, because I am aware, and I would like to ask staff to put up a brief clip, a video right now in regard to that, since you asked me to show you some evidence.
And we're just doing outreach and enrollment for the Affordable Care Act, also known as Obamacare. Do you currently have health insurance?
Cam Nguyen is a navigator hired by taxpayer dollars to help people enroll in one of the new health insurance plans. Her grant came through the nonprofit Southern United Neighborhoods in New Orleans. She canvasses neighborhoods, goes to churches and communities.
That's good. You can Mr. Cohen, what do you say to that?
I had not seen that before, and we'll look into it. And thank you for calling it to our attention.
Well, I hope you will look into it. I mean, some of my colleagues were very strong in saying that you should be fired. I don't know. My dad told me one time when I was in college and my grades came in and they weren't so good, and I said, Dad, I'm doing the best I can. And he said, son, unfortunately, your best just isn't good enough. I'm not calling for you to be fired, but, we're concerned. I mean, you've got a big job. You've got a huge responsibility. And you know that. We know that. And, back to the drawing board, but you got to do better. You absolutely. With that, Mr. Chairman, I yield back.
Checking to see who's next. Mr. Yarmouth, you're recognized.
Thank you, Mr. Chairman. Mr. Cohen, welcome back, and it's good to see you again. I'd like to start off by getting something clarified for the record. This relates to Ms. Blackburn's questioning. It's my recollection that what the President said was that after the Affordable Care Act was implemented, that insurance premiums, people would save $2,400 a year, opposed to what they would have been spending, compared to what they would have been spending if it weren't for the passage of the Affordable Care Act. Is that your recollection of what he had said?
That's my understanding of what he said, yes.
Not that people's insurance would cost $2,400 less.
That's my understanding, correct.
And in fact, as has been alluded to earlier in the various questioning, healthcare costs are rising at a much lower rate than they have historically. So while the numbers may not be precise, there's evidence to suggest that the President was actually correct in that insurance would have cost more if it weren't for the Affordable Care Act.
I think there's no question about that, and I think it's also true that many Americans are seeing actual reductions in what they're paying over what they were paying. Not every American, but many Americans are.
Right. Let's talk about the enrollment history because, first of all, it gives me an opportunity to boast about my state, Kentucky, which is widely recognized as having had one of the most successful rollouts of the Affordable Care Act. Currently, the numbers are, we've had, in a state of 4.4 million people, 778,000 visitors to Connect, our website, 123,000 plus have enrolled in either Medicaid or private plans. 559,000 Kentuckians have been screened to determine whether they were eligible for either Medicaid or subsidies under private insurance, and many of those have not yet selected their plan, even though they have been told that they qualify for private insurance. And 1,283 small businesses, this is as of January 2nd, have started the process to enroll their employees as well. So we're talking about already having insured about 20% or more of our entire uninsured population in just over half the, this would have been exactly half the enrollment period. And by the way, 40% of those are under 35. So in terms of Kentucky's experience, I think there's reason to be, as you said, optimistic that going forward we will have adequate numbers of young people in the risk pools, and we shouldn't be too concerned yet about that. But a couple weeks ago, there was, in one of the major national media, there was a chart that actually broke down the enrollments according to 3 categories of states. They had the 14 states in the District of Columbia, which had both expanded Medicaid and set up their own exchanges, states that have expanded Medicaid but were using the federal exchange, and then states that had not expanded Medicaid. And while I didn't do the math, it was pretty clear that at least 2/3 and maybe even 75% of all the enrollments, the 6 million or so enrollments, were in those 14 states plus the district where there was concerted government support for the program. So I'd like you to comment on that and whether you're seeing that the degree of enrollment seems to be correlated to the degree of support at the state and local level for the program.
I think that's absolutely right, and it's true for many reasons. Kentucky's a great example where Governor Beshear has been just a stalwart advocate for health care reform and for the Kentucky marketplace and getting it going. I think that contributes to the success that those states have had in terms of developing their marketplace and their IT systems. If the administration in the state is solidly behind that, it helps. It certainly helps with the outreach. It helps with the, sending out positive messages to people into the community of how important this is and what a great benefit this is for people. So I think there's no question.
Now, we saw a video there of navigators going door to door. There's another side of that coin as well. And I know I've talked to some people, for instance, in Florida, where they've actually been handing out flyers discouraging people from signing up. Have you seen much evidence that there is a concerted effort to actually discourage people from exploring their options under the exchanges?
I've heard some of that. I wouldn't be able to say how extensive it is. I think obviously it's very unfortunate that anybody would try to discourage people from taking advantage of an opportunity to get health care.
Just the last question. Is there any effort in your organization to try and find out or get evidence as to whether that's happening or not? Because that would, I think, be of interest to us.
I don't know that we're investigating that within SCIO, no.
Okay. Thank you. I yield back.
I think you now recognize Mr. Olson for 5 minutes.
I thank the chair and welcome Mr. Cohen. I hope you had an enjoyable holiday season like I did with my family.
Thank you.
My first question about a thing called the Federally Facilitated Exchange User Fee. Are you familiar with that fee, sir?
Yes.
Okay, so as you know, that's a fee that's imposed upon states where the providers that have not chosen to create their own health care plan have chosen to be in the federal health care plan, like my home state of Texas. And is that required under law, under the Affordable Care Act, that fee?
I think it's authorized by the law. And okay. we set the fee on insurance companies based on the premium that they get in the market.
Would it surprise you that HHS rule in November of 2012 authorized that fee, created that fee?
Yes, we issued a rule that implemented that provision.
Is it 3.5%?
Yes.
Is administration fully using that fee? I mean, do the plans and states have to cover some slack?
I don't believe that the amount of that fee will fully cover the costs of operating the federally facilitated marketplace. I don't think it's going to be enough to pay all of the costs of running the marketplace.
So you are tapping the resources of the private sector, the states, to pay the shortfall from this fee. It's not getting the job done, correct?
No. We're tapping resources from within our budget. But the fee is the fee.
Okay, and the fee is authorized for 1 year. Do you expect to extend it next year?
Yes, I expect there will be a fee next year.
Okay, my second line of questions are about the navigators. And as you know, that video from my colleague, Mr. Greenwood, was pretty damning. I mean, you recall when I asked you in here September 19th about the navigators, hearing rumors back home in Texas that they were having voter registration cards going door to door. And you said, and this is a quote about the navigators, we will be issuing instructions to navigators that they should not be going door to door, end quote. My question is, this is serious. Have you issued those instructions? Yes or no?
Yes.
Can we get a copy of those instructions? May we get a copy of those instructions
Sure.
so we can see them?
Sure, I can go back and tell you how we communicated that. I know we have regular communications with the navigators, and we put out that information to them that was something that they were not supposed to go door to door to enroll people. They could drop off information, but they were not supposed to go to door to enroll people.
And you've heard stories from New York and Florida in the New York Times that people, all the fraud that's been coming out with these navigators. What have you done, the agency, to address these fraud cases, make sure fraud doesn't happen? Because it's a big window of opportunity for people who want to do harm.
Any situation that we've learned about that involves any misconduct by a navigator, we have responded to. We have, including requiring individuals that were involved to be dismissed and not to serve as navigators, and including issuing corrective action plans to any navigator organizations that if we feel that they're not supervising their employees adequately.
One final line of questions about the disastrous rollout of Obamacare and the problems that continue. Delays and misinformation happen, and they're happening today all over America. For example, I got enrolled in the exchange here, the D.C. Public, the little small business exchange, my staff as well. My wife called up last week trying to make sure one doctor we like, we could keep this doctor, a specialist. It took her 30 minutes to talk to somebody on the phone. And she was asked to read her new information. She got her new Care First card up there, read it proudly, and they said, we have no record of that. So she had to get the old card and work through this agency to be confirmed that, yes, we could keep that doctor on our plan. And so my question is, given this disastrous rollout and the continued problems, have you ever been part of a conversation or a debate or discussion about delaying the launch or putting a hold on it with all these problems? Any discussion of that? Ever been part of that?
No.
No. Okay. I yield back the balance of my time. Thank you.
Thank you. Mr. Green, you're recognized for 5 minutes.
Thank you, Mr. Chairman. And again, welcome back, Mr. Cohen. I was shocked to see the news report in New Orleans because in Houston, our navigators do not go out and go door to door. We do have nonprofits that are not federal funded who are going in, and I'm encouraging them to come into our district to go out and let folks know they have this ability to do it. But the federal navigators we have, and now they will come out to someone's house, but it'll be at a request, or it'll be because, hey, I need somebody to help with the family or something. So I'm glad you're going to investigate that happening, because I want navigators actually helping people do the paperwork, or in the case filling out the effort. As one who supported the Affordable Care Act and continue that we need the law, and I'd love our committee to be able to work on it and fix some of the flaws that we have in it that we've discovered. But I'm pleased with the enrollment increases in the last few weeks. HHS released them earlier this week, and we know that nearly 2.2 million have signed up for the private insurance plans through the federal and the state marketplaces as of December 28th. 4 million more were signed up for Medicaid, and let's not forget that 3 million adults under 26 are still being able to get insurance through their parents. Do these enrollment estimates sound accurate to you?
Oh, yes. Oh, yes, I'm sure. I mean, they're as accurate as we can make them.
They're not as much as we would like, and I know the administration, but I have a memo from our Democratic staff on our committee that puts these numbers in context. Enrollment in the Affordable Care Act exchanges is ahead of the Part D enrollment at a similar time in 2006. Republicans then called Part D a success. Now they insist the Affordable Care Act's a failure. We still have a lot more work to do in other months ahead, but there is a doubt that a lot of people are finding, there is no doubt that a lot of people are finding access to quality, affordable health care. And I hope my Republican colleagues will sit down and work on legislation that will fix some of the problems we have, because nothing Congress ever passes is perfect, and we know that, and particularly with this. And instead of, just throwing rotten apples, maybe they should look back on what happened in 2003 when we passed the prescription drug plan that I didn't vote for. But I was also helping my seniors sign up for it and encouraging people to do it, even though I thought the law was flawed in 2003. Some of it's been fixed by Affordable Care Act, but it has, we want to make sure those folks get it, and that's what amazes me. Mr. Cohen, based on Massachusetts' experience with implementing health reform, would you expect enrollment numbers to look like over the next few months?
I think we're very encouraged by what we saw in December. I think we're encouraged by the tremendous interest that there remains in the plan. Clearly, Americans are now very much aware of healthcare.gov as a result of what's happened over the last few months. And I think everyone expects that as we move toward we still have, 2.5 months left to the open enrollment period, and I think everyone expects as we get towards the end of March, when it's the real deadline, we'll see another real uptick in the number of people enrolling, and if that happens, I think we'll have some very good total enrollment numbers by the end of the period.
Well, we know that the federal exchanges, 7 times as people signed up in December as did in October and November. Frankly, part of it is because of the website. And a lot of us have concern because that website was down. We did an event in Houston in the middle of November, and we actually had about 800 paper applications. And we had plenty of applications. I know there was an issue. We had paper applications both in Spanish and English that were used. But that's not the way we can get to the numbers we need. The website has to work. Finally, can you talk about outreach plans the administration has in place to ensure that as many people as possible learn about sign up for the new health coverage during the remainder of the enrollment period?
I think we'll be seeing significantly more paid media. I know there's a plan, as I mentioned, to advertise during the Olympics and other events that are particularly geared toward younger people, sporting events and those kinds of things. I know the social media activities are very much picking up, and I think from what I'm hearing, we're going to be seeing very significant investment by the private health plans in marketing and advertising as well. A number of them sort of held back because of the issues early on with the website, but now that they see the enrollments are coming through, I think we'll see significant investment on outreach on their part as well.
Thank you, Mr. Chairman.
Your time expired now. I recognize Mr. Griffith for 5 minutes.
Thank you, Mr. Chairman. Mr. Cohen, thank you for being here. In your responses to Ms. Blackburn, you indicated that many Americans have better plans at a lower cost. Do you recall indicating that to her?
Yes.
Under oath and in your sworn
Yes, many Americans have better health coverage than what they had before, and it's costing them less. I think I mentioned at least one of them, in my oral testimony.
Yes, you did. You actually mentioned a couple, one of them from my district, and I understand that. Also, you would have to acknowledge, under oath, that many Americans have lesser coverage at a greater cost. Isn't that true?
No, that's not what I said. What I said was...
That isn't what you said. Yes or no? I'm asking you a question under oath.
I don't believe...
You know that many Americans have lesser coverage under the Affordable Care Act at a greater cost than they had before. Isn't that true?
No, I don't know that.
You don't know that. Well, let me tell you, I received an email today from a constituent of mine who I know very well. His premiums in March are going to triple, and his deductible is doubling. That's lesser coverage at a greater cost. So there's one. I will tell you that I have received numerous communications from members of my district, people who live in my district, along those lines. And yes, there are some winners, but there are also many losers. And it shocks me that you cannot acknowledge that here today when you're testifying under oath in front of this committee. There are losers under Obamacare, aren't there?
Can I answer?
Well, it's a yes or no. You know that there are losers under Obamacare, do you not?
If I'm not allowed to answer, then
the answer is either yes, you know that there are losers, or no, you don't know that there are losers. It's a yes or no, sir.
Will the gentleman yield?
I will not yield. The witness is not being.
I think you need to define losers.
A loser is one who has to pay more for coverage that's lesser. And I just gave him an example, but he won't acknowledge that he knows of anybody in the United. Do you know of anybody in the United States in that circumstance, sir?
I'm sure.
Yes or no?
I'm sure there is anybody in the United States in that circumstance. Yes.
And do you acknowledge that you have, just as you read the reports on other people who have had some successes who are winners under this, you've also read reports in the media of people who are losers under Obamacare, have you not?
The problem that I have, Congressman, is that I don't know what all of the options that might be available to that person. So it's difficult for me to answer without knowing the full situation of what might be available to that person. I understand that there are people who had coverage and received a notification from their insurance company that they were being put to a different plan that cost more. Absolutely, that's happened.
And you have reason to believe that those people are paying more and receiving a lesser coverage.
Well, I don't know the details of what their plan, the plan is that they were in, what the details of the plan is that they were being offered, and I don't know the details of what other plans might be available to them that might enable them to avoid that situation. So I think it's a little bit more complex than you're presenting it to me, and you're not. That's all.
Well. And I would submit that it's more complex on all of these situations because we have a 2,000-some page bill that's very hard for people to get their arms around, and it's very hard for this administration apparently to operate and to run. That being said, let's talk about the shop exchanges for small businesses. That is another part of the plan that has been delayed for a year. Is that correct?
The online capability for shop is delayed for a year. Yes.
And many of the other delays were for a few weeks or months. Why was this program delayed for a year?
Given everything that we needed to do to get the system working well for people in the individual market, we made a decision that in terms of allocation of resources, we couldn't get the shop online functionality built in time for this year. And so we are relying on the traditional agents and brokers who historically have always been the way that small.
It was a complicated situation that you had your hard time getting your arms around, and maybe if you sat down and learned all the aspects of it, you could advise on.
No, we had to make a choice. We had to decide what to devote our resources to.
I
know you were.
Here's my problem, and this happens so often with this. The delay was announced the day before Thanksgiving, wasn't it?
I believe you. I don't remember, but I believe you.
Do you know if there were conversations before that day before Thanksgiving announcement? How long in advance was the decision made to delay the shop plan?
I'm sure that there were conversations before it was announced. I wouldn't be able to tell you exactly, when, but I know that into November there were conversations, and then when a decision was made, and then it was announced.
There's a great concern for a lot of us that a lot of these announcements come. We've even made comments in other hearings that these announcements come at holidays so that people will be doing other things and won't pay attention to the fact that there's yet been another delay, another failure in the rollout of this program. Do you agree that that's not an appropriate way to run the operation, and that it really ought to be coming out when people can know what's going on instead of during the holiday time when nobody's paying attention?
Well, I would agree with you that it's very important that we put out accurate information so that people can understand what's happening with the program. Yes.
Gentleman's time, so I would now recognize Mr. Tonko for 5 minutes.
Thank you, Mr. Chair, and thank you, Director Cohen, for your testimony once again before the subcommittee. I believe we should have civil discourse with you, and so I'll try to conduct myself accordingly. Before I get to my questions, I just wanted to share with the committee an Obamacare success story that I recently received from a constituent. Brian from the city of Schenectady wrote to me that he had been paying almost $360 per month for a plan with no dental or vision coverage. Through New York State's online exchange, he was able to get a comparable medical plan and also purchase dental coverage for $290 per month. As he described it to me, this is more coverage for less money. Brian was able to complete the process in less than 2 hours, and because he makes only $11 per hour, the difference in premiums is having a huge impact on his budget. Brian is not alone. As of January 1, more than 241,522 New Yorkers were now enrolled in quality, low-cost health insurance coverage through My Home State's exchange. In addition, more than 6,500 young adults in my district now have health insurance through their parents' plan, and more than 12,100 seniors in the district receive prescription drug discounts worth $16 million. 124,000 seniors in the district are now eligible for Medicare preventative services without paying any copays, coinsurance, or deductibles. I could go on, but the point is that the Affordable Care Act is here to stay, and it is providing an enormous benefit already to the people of the 20th Congressional District of New York, which I have the good fortune of representing. It never ceases to amaze me how hard my Republican colleagues work to avoid acknowledging the benefits of ACA. I've never heard them admit that this law helps the millions of Americans with pre-existing conditions who can no longer be discriminated against. Mr. Cohen, can you summarize for us some of the important new protections that are now in place under the Affordable Care Act?
Well, certainly, thank you, Congressman. Absolutely, the issue of pre-existing conditions is a huge one. Previously, people could be denied insurance altogether, even because they're sick, at the time that they're applying, but because they had some condition in the past that caused the medical underwriters to say that they weren't a good risk. And then if they were offered insurance, notwithstanding whatever that pre-existing condition might be, they could be charged significantly more as a result of that. And one of the impacts of that, of course, was the fact that women were being charged, substantially more than men because being a woman was deemed to be a pre-existing condition. So all of that is gone. And then the last one I would mention that I think is very important is that in the past, people could find that if they did become seriously ill, their insurance would run out because they had either an annual limit of how much it would pay or a lifetime limit over how much it would pay, and they might be in the middle of, a course of treatment that was necessary to save their lives and find that all of a sudden the insurance companies stopped paying and that they were responsible for those costs on their own. And that can't happen anymore.
Thank you. The stories of people signing up for coverage would drive home how important these new provisions are. And I know some stories have recently been posted. I read a story about Nick from Miami. He's 29 and was denied coverage last year because of a pre-existing condition. He was forced to enroll in a short-term catastrophic plan that cost him $280 a month and had a termination date. Because of the ACA, he now has better coverage with lower out-of-the-pocket costs and a guarantee that he won't be kicked off his coverage or denied because of a pre-existing condition. Now he's covered, and he does not have to worry. There are more of these stories each and every day. Albert from Texas got covered for the first time in his life because of the ACA. He got a plan for only $23 per month. He said it's the right thing to do. You never know what could happen to you. Mr. Cohen, have you heard other stories like these?
Yes, we're hearing stories like that all the time, and we're seeing them, through social media. We're seeing people are sending us their stories, on healthcare.gov. There's a place where you can, provide your story, and I must say, they're extremely heartening.
And, what do they say to you about the importance of the Affordable Care Act?
The Affordable Care Act is literally going to be life-saving for many, many, many Americans who, without it, would not have had the ability to get the health care that they need, and it's going to be a financial lifesaver for many Americans who otherwise would have faced bankruptcy as a result of medical costs, which was the leading cause of bankruptcy in the country, prior to the ACA, and I think we're going to see that change dramatically.
Well, I just wish our colleagues would just admit for even the briefest moment that this law is helping millions of people. Maybe then we could move forward and have a national conversation about the Affordable Care Act and any additional improvements that might be required. So with that, I thank you, Director Cohen, and thank you for appearing before our committee.
Thank you. Gentleman yields back. Now go to Mr. Long of Missouri for 5 minutes.
Thank you, Mr. Chairman. One person that does not think this is a life-saving endeavor is Brenda from my district. And Brenda has been fighting a very rare form of cancer for the last 7 years. And she leaves Springfield, Missouri to go down to Little Rock, Arkansas to seek treatment. She's in a high-risk pool. She was in a high-risk pool. When she found insurance, she found out that she could no longer go to Little Rock, Arkansas to seek treatment from this very specialized doctor that has literally kept her alive for the last 7 years. They gave her 3 months to live when first diagnosed. She got active. She's mid-50s, late 50s. And back then she was early 50s, I guess. 50 years old, and she decided it wasn't time to die, so she wanted to fight and get active and find a treatment for this. So she did, down in Little Rock, Arkansas. And she called me from her chemo chair, or texted me, emailed me from her chemo chair, telling me that she had lost her insurance. And when she found new insurance, because the high-risk pool was going away, when she found new insurance, she was told that she could no longer seek treatment down in Little Rock, Arkansas, from this doctor, who's one of the few in the country that does it. So I know you say it's life-saving. I know that my friend from New York says that he wants people on this side of the aisle to admit there are good cases. Sure, there's people that are picking up insurance. There's good cases, but there's also people that this could very easily cost them their life. So I'm concerned for people like Brenda. Let's talk about those high-risk.
We certainly would like to hear from you about Brenda's situation, if there's anything we can do to work with the insurance companies.
And I appreciate that.
We'd be very happy to do that.
Yeah, I gave a floor speech on the subject a month or so ago whenever she first emailed me, and she was literally in the chemo chair in Little Rock taking the treatment, and she said all the nurses stood up and cheered my floor speech in the rooms. And but there are serious concerns for people like Brenda. Sticking with the high-risk pools for just a minute, I know that this new national high-risk pool, as opposed to the state-run ones that ran out the end of December or whatever, have been extended to the end of the, what period?
End of March.
End of March. What, how are those being paid for? I mean, where are you getting the money to pay for those? Who's paying for that? We cannot get any answers, at least my staff has not been able to, on how this is being funded.
Well, that's very clear. I mean, there was a $5 billion appropriation in the Affordable Care Act, and that's the entire amount of money is that $5 billion appropriation that was in the Affordable Care Act that has paid for the PSIP program. And we had...
well, that wasn't that... I hate to interrupt you. That's not my style, but the $5 billion, wasn't that for a set amount of time? But with these, we keep getting these extensions that don't seem to be paid for.
So the statute says that we can use that money to ease the transition of PSIP enrollees into the new market. And so what we found was we had enough funding based on the number of enrollees we had and the costs that we're incurring to allow those benefits to continue through March. And as of by the end of March, everyone who's in that program needs to get private coverage, and that program will...
Or they won't be able to seek coverage in Little Rock. So that's the rub there, I think. But the ranking member said earlier, and my friend from Florida made reference to the fact that there's all these people that have new coverage, all these people that have enrolled in the Affordable Care Act that didn't have coverage before. How can we drill down and figure out what that number is? Because just because 146,000 in Florida and Ms. Castro's district signed up in December, how do we know that those people did not have insurance before? How do we know they're not like Brenda that was forced off her plan and hopefully can find another plan? Is there a way to ascertain if these are true numbers, if these are really people that are covered for the first time ever? They now have health care insurance that never had it before.
So that's a really good question, and we're working on being able to provide data as to the number who were previously uninsured versus the number who may have been insured before and are switching to new coverage. And we understand that's an important issue. We don't have that data today, but we're
okay. If you can work on that, because it just, one side tells one side of the story, one side tells the other, and usually, as you know, the truth lies in the middle. So when I hear how many people that never had coverage before, I question if they didn't have, lost it, and bought new. So thank you for your time here today.
Thank you.
The gentleman yields back now, Mr. Butterfield, for 5 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Cohen, for your testimony today. I want to assure you, Mr. Cohen, that when the history of this debate is written many years from now, I promise that you will be regarded as one of many people in this administration and across this country who were on the right side and helped millions of Americans get insurance. You are doing the right thing, and I want to thank you for what you do.
Thank you.
But, Mr. Chairman, this is getting ridiculous. My friends just won't let go. I think Mr. Tonko made reference to it a few minutes ago. Let me try to put this in somewhat of context. Yesterday's New York Times wrote that North Carolina Senator Kay Hagan has faced more than 3,500 negative ads about the Affordable Care Act since June the 1st. That amount of negative ads is more than 3 times as much as any other member of Congress. $5 million has already been spent on negative ads related to Obamacare in my state of North Carolina. The fact is, Mr. Chairman, the Affordable Care Act is the law of the land. It is working in my state. The Brenda in my district is named Carlton Stevens, Jr. I drove up to an Exxon station a few days ago, and little Carlton, we called him, jumped out of his car and told me how excited he was that he had signed up with the Affordable Care Act, told me that he was paying $700 a month for he and his wife and 2 children, that the premium was going up to $800, that he enrolled in the Affordable Care Act and is now paying $240 per month. The fact is, and the reason Mr. Cohen had difficulty in trying to describe winners and losers, is that each case is unique. You have to compare the coverage. You have to compare the cost. You have to compare the circumstances. And so the Brenda in my district is Carlton Stevens, and he's getting insurance now for $240 per month. Of all states participating in the federal exchange, my state, Ms. Elmer's state as well, had more than 107,000 enrollees from October to December, which constitutes the most enrollees in the federal marketplace per capita. 89% of those enrollees are low or middle income and qualify for a tax credit for their plans. North Carolinians are having tremendous success with the federal marketplace and healthcare.gov. In fact, North Carolina leads all of the states in Health and Human Services Region 4, with more than 61% of individuals who complete an application selecting a marketplace plan. Nationwide, the trend is very similar. By the end of December, nearly 2.2 million had enrolled, and several 100,000 more have enrolled since then. Tuesday's Washington Post cover story stated, quote, "The data show a sevenfold upswing in enrollment in the federal exchange from the first 2 months as the website's performance improved," end of quote. And so, Mr. Cohen, I want to ask you, can you describe for me the trend in the number of adults 18 to 34 who have selected these marketplace plans?
I think we reported that the 18 to 34 was about 24% of the enrollments, and that was very close to the percentage of that age group in the general population. So we're quite pleased by that, and we expect to see that number increasing as we move through the rest of the open enrollment period.
Well, talk to me about some of the national campaigns which will help to begin to get youth enrollment up higher than even 24%, so perhaps to 40%.
So I know that we are going to be doing a lot more paid media, specifically around the Olympics, which will be starting in a couple of weeks, and around other sporting events and other activities that we would expect young people to be particularly interested in. I know we're doing, have been doing, and are doing an increased amount of outreach through the social media, Facebook, Twitter, all that sort of thing. And I know that all of our advertising is very targeted to try to reach the populations that we, most want to get in. Obviously, we want everyone to enroll, but we want to particularly focus, obviously, on the young people, as we've talked about.
Thank you. Well, lastly, I made reference to my home state of North Carolina in my introductory statement, and I'm very proud of the enrollment rates there. I have 700,000 people in my congressional district, and I tell you that 100,000 of those 700,000 is uninsured, and this is making a difference. What factors do you believe contribute to North Carolinians choosing marketplace plans at such a high rate as compared to the national norm?
Well, I mean, I have to believe that in places that where the need is the most, is where we're seeing the biggest response. So in places where the rate of uninsured was high, I think that's where we're seeing the biggest response.
Thank
In response to his question, do you know how much you're spending on the Olympics advertising?
I actually don't, but I'm sure we can get that.
Would you please let us know? Thank you. Now recognize the gentlelady from North Carolina, Ms. Elmers.
Thank you, Mr. Chairman. And to my colleague from North Carolina, Mr. Butterfield, I'm going to kind of extend some of the questions to you, Mr. Cohen, where Mr. Butterfield left off.
And adjoining districts, we might add.
Yes.
Adjoining districts.
You know, my colleague, pointed out that about 107,000 have enrolled in North Carolina. That's the figures that we're seeing. However, 473,000 received cancellation notices for their health care policies that they already had. So even though that 107,000 may sound impressive, we are way behind on those who have had their policies canceled. So there's a lot of making up to do. I do want to get back to some of those numbers. Now, correct me if I'm wrong. How many people in America do you believe have signed up for coverage now?
Well, the most recent figures that we put out were 2.2 million, and that's just in the marketplace. Obviously, there are people who are buying coverage.
So the 6 million figure that I keep hearing today, where is the 6 million figure coming from?
That's taking the 2.2 and adding 3.9 million who enrolled in Medicaid.
Okay, so so basically what we're doing is we're culminating. And are you aware that the Washington Post gave 3 Pinocchios to this number? Are you going to keep this figure?
I didn't see the Pinocchios. I'd have to take a look at what they called into question.
So you agree with the $6 million figure? You believe that there have been 6 million?
I believe that as we reported, 2.2 million have enrolled in marketplace plans, and about 3.9 million had enrolled in Medicaid. And I think the Medicaid number was actually only through November.
Okay, now of those who signed up for Medicaid, how many of them could have previously signed up for Medicaid but did not before Obamacare was instituted?
I don't have that number for you.
You don't have the number? Can you get the number?
I can certainly ask my colleagues in Medicaid if they have that number.
Okay,
I don't run Medicaid, so
that doesn't fall under you.
No.
Okay. Well, so now we have a situation where we have a number of Medicaid that signed up. Wonderful. We want to make sure that people have coverage, that is applicable to them. But isn't this going to play into the cost factor, especially for those states? When we don't really know where the numbers fall out as far as which those who could have signed up before but did not for whatever reason and now have.
Well, the states that expand, the newly eligible will be paid 100% by
right, the newly eligible, but those who could have received coverage before, the states are going to be responsible for a percentage of that, correct?
That's right, under the usual match, yes.
Okay. Now, you said you don't have the number, you don't have the figure. When we had Secretary Kathleen Sebelius, she said that she did not have that number, and I believe she actually said that they could not get that number. So I would appreciate if you could get that to us in the committee, because that I think the thing of it is, and I'll just quote the Washington Post fact checker. Basically, what he said is this number tells you almost nothing about how the health care law is affecting Medicaid enrollment. Reporters need to stop using it, because basically, and that's a quote, because it's very misleading. It's very misleading. Now, I do want to get back. I've got a little bit more time here. We're all sharing stories about our constituents, and, some of the stories that we've heard have been positive. I want to hit on the issue of the change for women, because I keep hearing about the issue about, bringing down costs for women. However, I have a woman who was formerly in my district, is not in my district now, from Rocky Mount, North Carolina, who basically reached out to my office and through, personal situation, lost her health care coverage. And now the plan, she was paying $254 a month. Now she's going to have to pay $610 a month. She simply cannot afford it. She's probably going to have to choose to not take coverage. How, when we continue to claim that health care has improved for women with, mammograms, when we call these things free, how did we go from $254 a month to $610 a month, and we can still claim that she's getting free services?
So again, I really can't address an individual situation without knowing more of the specifics. Would be happy to have folks talk to her if she is interested.
Well,
I
I would appreciate that. I will have my staff get that information to you and your office so that we can work. Because if we are really going to take care of women in this country, health care issues for women, let's be straight on it. Let's make sure that we are getting the points across, because women's health is very, very important, and this is very misleading. So with that, I yield the remainder of my time.
Finally yields back. Now recognize Ms. Schakowsky for 5 minutes.
Thank you, Mr. Chairman. I want to talk a little bit about constituent service when it comes to health care, because long before the Affordable Care Act, my office spent a lot of time dealing with insurance problems. People who suddenly weren't able to get the medication that they had been getting before. Really tricky issues that sometimes we could solve and sometimes we couldn't solve. So the private insurance market, as it was before, was very difficult to navigate. I think that's really important to remember. But I have to tell you, Mr. Cohn, we have done constituent service with your office on many occasions now since the Affordable Care Act is in place. And I'm happy that you were able to tell my friend, Mr. Congressman Long, that you would look at the Brenda situation and work to get her the health care that she needs. And I would suggest that my experience has been that we have been able to resolve through your office many of the problems. Yes, this is a confusing time, but I guarantee you that before the Obamacare, it was very confusing every year, and by the way, still is with Medicare Part D. And we, really encourage all of our constituents on that program to look every single year to make sure that their medications are still on the formulary.
And if I can just say, Congresswoman, we have gotten tremendous response from the insurance industry, from the pharmaceutical industry, as we've tried to resolve these problems this January. And I have talked with the issuers, I've talked with the pharmacies, I've talked with the Hospital Association, and what I'm hearing from them is that the nature of the problems that we're seeing as we moved into January and people using their coverage are no different from what has happened every year as people get new coverage, change coverage. There are always issues in terms of, people being able to verify their enrollment, being able to see their doctor, all those kinds of issues. And we stand ready to help. We have caseworkers in every single region of the country, and we stand ready to help anybody if we possibly can.
And I know that in my state, Democrats and Republicans are working very hard to help their constituents, and so I'm hoping that everyone on the other side of the aisle on this committee is taking advantage of the constituent service that's available from you, and then also through the insurance companies and the pharmaceutical companies. I wanted to, again, go over a little bit on the issue of these letters of termination. Insurance companies that we've talked to said they expected almost all of their current customers to stay covered. Have you seen evidence of that?
Oh, absolutely. And so it really is not accurate to think that because a plan is no longer being offered, that means the person's not getting coverage.
And let's be clear, it's not offered because it doesn't meet the criteria of the 10.
That's right. And so in every instance that I'm aware of, the carrier offered the person a new plan that and in some cases automatically enrolled them in a new plan so that there would be no gap in coverage. And then in addition to that, of course, we've through our transitional policy, we've made it possible for people to keep their existing plan if that's what the insurance company wants to offer to them.
My understanding of this issue of the grandfather option enables about half of those who received cancellation notices to renew their plan. Has this been happening?
That's right.
And roughly half the remaining group that got cancellation letters, my understanding is, are able to get actually a better deal through the federal and state marketplaces because they're eligible for tax credits or Medicaid, so they get better coverage for a lower and often much lower cost.
So for people who are eligible for the subsidy, absolutely we would expect that they would pay less and they would in many cases get better benefits than what they had had.
And finally, in December, the President announced that individuals who had canceled policies would be eligible for a hardship exemption so they could purchase a low-cost catastrophic plan. How will this change the options available to those that got cancellation?
So what that basically means is anyone who got a cancellation and feels that the plans that are available to them are not affordable can claim the hardship exemption and can enroll in a catastrophic plan, which is a high deductible plan but will cover them in the case of any serious illness. And those plans are generally very affordable.
Thank you. I yield back.
Chair recognizes Mr. Johnson for 5 minutes.
Thank you, Mr. Chairman. Mr. Cohen, I too would like to thank you for being here today. You know, we've had a long and arduous journey since this all started and the American people came under the Affordable Care Act back last October, the website going up. You mentioned in your testimony that you know, the problems that we had, that it wasn't time to give up, it was time to roll up our sleeves and get to work. Well, I respect that, but I'll submit to you that we've got a little bit of a different idea about what roll up your sleeves mean. You see, the American people, businesses, individuals, hardworking taxpayers across this country who are increasingly burdened by the big spending, over-regulating policies of this administration. Not very many of those folks get a second chance. Only in Washington, D.C. and with this administration do we see a constant pattern of redo at somebody else's expense. In this case, it's the American people's expense. So I submit to you that what we should have done, what the administration should have done, is roll up its sleeves and do this the right way in the first place. Let doctors and patients manage their health care. We've got a private sector health care system that has provided the best health care in the world. It did not have to be done this way. Well, let me get to a few specific questions. Since the launch of healthcare.gov, Mr. Cohen, has the site been subject to any security breaches?
No.
No security breaches?
There have been no breaches in the sense of anybody attacking the site and being able to...
There have been no incidences of people attacking?
No, where they were successful.
That's what you just said.
Well, because you interrupt me, Congressman, I don't get a chance to finish what I'm trying to say. No, there have been no successful attempts of where anyone has been able to attack the system and penetrate it.
Wow, that is contrary to what we've heard in other testimony and what is widely known in the media.
Mr. Chairman, I respectfully disagree with that.
Claiming my time. What is the difference, in your opinion, between a security incident and a security breach?
You could have a security incident where, because of an error or a mistake, or somebody sent something to the wrong place, or that was an isolated, specific incident where information was transmitted in a way that was incorrect. A breach. When I hear breach,
how do you relate that back to the testimony that we've heard before the Energy and Commerce Committee that security was never even factored in and tested prior to standing up the website? So, can you promise the American people today, right now, that their personal information is secure on website.gov?
Yes. I can't promise that there won't ever be an incident, but I can promise that their information is secure, and I can promise that
sounds like an oxymoron to me. You can't assure that there's not going to be a breach, but their information is secure.
That's not what I said.
Let me ask you a follow-on question. Can you promise to this Congress that if healthcare.gov is subject to a breach or a hack or any security failure, that you'll alert the Congress as soon as you find out about it?
We follow normal procedures and protocols for when those incidents happen.
But the American people need to know, and this Congress needs to know. So can we get your agreement that you'll notify Congress if that occurs?
We'll certainly work with you to make sure you get that information.
Okay. Whose job is it to inform Congress and the American people when a security breach occurs? Whose job is that?
CMS has an Office of Security, Information Security that's responsible for that, and is today in the case of the Medicare system where we have 50 million enrollees that whose data.
I got it. CMS is responsible. Who is responsible for the overall cybersecurity of the healthcare.gov site?
I think that's the same.
Do you know how many people in CMS are dedicated to protecting the security of healthcare.gov?
I couldn't tell you a number of people. I know we have a dedicated security team. I know we do continuous monitoring. We actually have people watching the site 24 hours a day, 7 days a week.
Do you know how many contractors are involved?
I don't.
Do you know how much money? Do you know how much money is being spent to provide
security? I would have to get that number for you.
Does anyone report to you regarding the security of the site?
My office is not responsible for the security of the site, but I am given reports on.
Okay, can you give us examples of those reports so we can see what those reports include?
I can certainly take that request back and see what we have.
Okay, well, I mean, they come to you, so you ought to be able to release them, right?
I can certainly take your request back and see what we have.
Okay, Mr. Chairman, I yield back.
Mr. Chairman, go ahead.
No, I was just going to say that a number of the reports on attempts to hack into the system are classified, and we can make that available to all members to know that there have been multiple attempts. There's not been a breach yet, but I'm sure the attempts will continue on. But much of that is classified. So,
Mr. Chairman, on that vein, last week, Democratic staff of the subcommittee and full committee prepared a memo of information that was provided in the classified briefings, which is not classified. A lot of the information, I was at the classified briefings. A lot of that information was not of a classified nature, and so, and what that information said is there are no successful hacks of healthcare.gov, and it further said that surprisingly there have been no additional attempts than other government websites. And so I would ask unanimous consent to put that memorandum, which is dated January 9, 2014, into the record.
And we'll take that in the record. We will also remain vigilant because we suspect there will continue to be attempts. Now, there is some time left on the floor for votes. Ask members, we can adjourn to go vote and come back and complete this.
I think we have time.
Would you like to continue? Who's next? Mr. Harper, you're recognized for 5 minutes.
And thank you, Mr. Cohen. Good to see you again. We're almost done. I'd like to ask a few questions, if I could. You touched on earlier in response to some questions about risk corridors.
Okay.
And it's a program to offset huge cost increases, being the temporary risk corridor program. Where within the administration is this program housed? Is it HHS, CMS, or where?
The risk corridors is under my program.
Okay. And the individual in charge of that program would be who?
The person who works for me, who is responsible for that program's name is Sharon Arnold.
So is it just that one person then that would be the one in charge?
Well, she runs that program. Oversee. She reports to me.
Okay.
So I'm responsible, but she works for me, and that's her program that she's managing with other people, with her staff.
And there are other staff then, multiple people would help her to run that program.
That's true.
And would you be able to provide us a complete list of the staffers who do perform any service connected to the risk corridor program?
Yes.
Thank you. Under this program, if insurers are hit with costs greater than 103% of their premiums, the government will give them money. Am I correct?
That's right.
How will
and there's certain. It's a little more complicated than that, but yes.
And I've got a couple of follow-up questions that may allow you to answer that. How will the determination be made of what these costs are? I mean, is there a form or
the insurance companies will have to present data to us on their healthcare expenditures, and then it won't be until 2015 that we actually make any payments under the program.
So, can you tell us exactly how the insurers will report this? I know it has to be they're going to report it, but how are they going to report it?
There will be a forms or templates or whatever that they will have to provide to us, the accounting information that will tell us what their healthcare spending has been.
Okay, and I've got follow-up too on some enrollment questions, if I can kind of shift over to that.
Sure.
The most important number, as has been reported by many news outlets, is whether individuals have paid. Does the administration collect this information? I'm just asking, do you collect this information?
Right now, we're not, but we will be.
When?
As soon as that functionality is built. I think I answered some questions about that earlier, that not all of that functionality is built yet.
Will that mean then that we have to go back, all those who are enrolled, find out whether or not they've paid, so that we'll have to go back to those who are already in? We're not collecting it as it occurs?
We ultimately will reconcile to make sure that the advanced premium tax credits, for example, are not paid with respect to anyone who didn't pay their premium, because that's a requirement that you pay your premium in order to get the tax credit.
What department would have this data?
It's going to come to my office, to my agency.
Who would be the individual that would be in charge of that
That's
operation?
also Sharon Arnold.
How many? So we don't know at this point how many people have actually paid for coverage.
That's right.
So are you telling me that you don't have any data, you haven't received any information as to who's paid, or you just haven't compiled it yet?
We have gotten enrollment data from the issuers with respect to the APTC payments that we're going to be making next week, but it's not on an individual basis. So they've told us who the number of people who are enrolled and who have paid, but we don't have it on an individual basis. Which ultimately we will.
And I didn't mean to cut you off, Mr. Cohen.
That's right.
Are you telling me you're going to be paying insurers without knowing whether or not the insureds have been paid?
No, we're going to be relying on data from them as to who has paid, but we don't yet have an automated system.
So if you're relying on that,
and we will reconcile that as soon as make sure that those numbers are reconciled and are correct once we do have the capability of receiving the additional.
All right. Well, do you know the total amount of paid from each insurer at this point? Since you're relying on that data,
we have information on what we're going to be paying to each insurer in this first group of payments that's going out next week. We do have that.
Can we go ahead and get the data that you do have, whether it's compiled or not?
I'm sure you can.
Okay. All right. I believe my time's almost expired. I'll yield back.
Jimmy Owens back now. Recognize the gentleman from Colorado, Mr. Gardner, for 5 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Cohen, for your time today. I, too, received my insurance cancellation. Have you ever met anybody who had their insurance canceled?
You may be the first.
That's pretty shocking because 335,000 people in Colorado alone had their insurance canceled. The letter that I got that told me that it would be canceled included this option. Your option includes purchasing another individual health plan from us, purchasing a health plan from another carrier, or purchasing a new plan through Connect for Health Colorado. Was the President's promise that I could keep my health care plan upheld? The President's promise to me, was that upheld?
Well, I mean, we've talked about this a lot. The law provided that insurance companies could keep the existing plans as long as they didn't make significant changes to benefits and cost sharing. Insurance companies made different choices. There are still a lot of grandfather plans out there, and those maintained. But then there were other plans that did not continue into 2014. So in some cases, those plans were canceled.
And so was the President's promise upheld to me? I mean, I don't remember the President saying there's qualifications if you like your health care plan. There's no asterisk.
The law made it possible. The law made it possible for everyone who was in an existing plan as of the time it was passed for that plan to be maintained, but it didn't require insurance companies to continue offering them. So what we did in November was we offered another opportunity to say to insurance companies, you can keep those plans in place even if they didn't meet the requirements of the grandfathering provision.
So these changes to allow that these are big changes that you'd have to go, or would a $5 change require them to discontinue the plan?
There was a percentage change that was in the regulation as to how much, and it wasn't a change in premium, it was a change in benefits or cost sharing.
So a copay of $5, that would require you to lose your insurance then?
I think that was one of the requirements.
And so is that a significant change to an insurance policy in your opinion?
Well, if a copay was $20 and it goes up $5, that's pretty significant, yeah.
So the President's promise, so really in your mind, he shouldn't have even had to apologize because he didn't do anything wrong.
I think the President said that he recognized that what he had said did not prove to be true for many Americans. And as a result of that, we offered another transitional policy to make it be more possible for more Americans
And
to
do
keep their plans.
you have legal opinions that give the president the authority to make these extensions and changes? Could you provide me with the legal memorandums?
I'd have to go back. I honestly don't recall whether we had a legal opinion on that particular issue.
When did you testified in September, as we've talked about before the committee, talking about everything going fine and it would be fine. When did you first know that it wasn't going fine? Was it September 27th, 28th, October 1st?
October 1st.
So you had no indication prior to October 1st that things weren't going well?
I had no indication, but prior to October 1st, that we were going to have the major problems with the website that we ended up having.
When did you first know that people would have their insurance canceled?
I think we've always known that not all of the grandfather plans were going to continue. I don't think we had necessarily a sense of how many would and how many wouldn't.
When do you expect small business plans to start canceling insurance?
That will likely happen throughout the course of the year. Small business plans don't tend to all come up for renewal in January. Many of them were renewed early in 2013 so that they will continue.
And how many do you anticipate being canceled?
I don't have a number of that. I don't. We can look to see if we can come up with a number.
If you could provide an estimation of how many additional insured you'd think will be canceled, that would be great. And so do we have an idea of how many signed up through the Federal Exchange so far? I know some of this we've talked about before, but how many people have signed up through the Federal Exchange?
Well, we reported that as through December 28th, it was 2.2 million in the federal and the state, and of those, it was something over 1.1 million were in the federal.
Okay, so about 1.1 million in federal, 1.1 million in states?
Roughly, yeah.
Okay. How many of those who signed up in exchanges were not previously insured?
And I don't have that number.
How many were previously insured but had their insurance canceled and now signed up in the Federal Exchange?
I don't have that number either.
How many saw their insurance rates go up?
I don't have that number.
But you said that you know of a significant number of people who saw the rates go down.
As we've been hearing,
so you don't know for sure if their rates went down. You're hearing anecdotal evidence.
We're hearing anecdotally, and I think
so
that
we don't have any concrete numbers on whether rates went up or down. As in the government.
I think that we know that for people who are eligible for a subsidy, that for those people it is almost certain that their costs would have gone down.
So you have some numbers, but you don't know how many went up. Okay. So of the supposed 45 million without insurance, how many people now have insurance?
I don't think we have that number yet, but certainly we're going to try to come up with as good data as we can as we go forward, through to the end of open enrollment.
How do we know the law is working?
Well, we know the law is working for many people, and we know that...
But you don't know how many of the uninsured are now insured. You don't know how many people saw the rates go up versus rates go down. Insurance companies aren't being paid yet. Let's talk about the risk corridor provisions. What is the probability of the risk corridor provision being utilized or activated?
Utilized?
What is the probability of the risk corridor language being utilized?
Oh, I think there will be a risk corridor program.
No, but what is the provision of that language being activated and payments being made from the government to insurance companies? What's the probability of that?
Oh, that will happen.
So you're saying that the government will be paying private insurance companies?
Oh, how likely it is that there will be claims on the program?
Yes.
I think we anticipate that there will be claims on the program, but there also may be some whose costs are lower than what they anticipated, and there'll be payments into the program. And I think the estimate was that it was budget neutral.
Gentleman's time has expired. Dr. Bridges, do you have a follow-up question on something? I'm just going to give you 30 seconds as we'll have to go.
Well, I know we'll have to do this for the record. Mr. Cohen, we're interested in any legal memoranda that you've been advised of or briefed on that define the authority under the Affordable Care Act to delay implementation or the authority to exercise enforcement discretion over enforcement provisions. We all know this law that was signed in March of 2010 bears no resemblance to what is actually going on today because of the variety of enforcement discretions and delays that have been implemented by the administration. We'd like to know under what legal authority you are operating or what you have seen that gives you the legal authority to do so. Thank you, Mr. Chairman.
You'll provide that for the record, Mr.
We'll
Cohen?
certainly take that request back and work with you.
I also would like you to follow up with the other questions that members on both sides of the aisle asked as follow-up questions. I'd really like to know Mr. Gardner's answers to his questions he asked about just how many people of the 45 million that originally was supposed to help are signed up and if it's more or less expensive for them. And I ask unanimous consent that the written opening statements of other members who wish would be introduced to the records. And in conclusion, I'd like to thank all the witnesses, the witness and members who participated in today's hearing, and remind members they have 10 business days to submit questions to the record. And I ask Mr. Cohen if you would please agree to respond promptly to the questions. And with that, this committee hearing is adjourned.